Hi, everybody. I'm Dr. Joel Richnack, and I want to thank you all for joining us tonight, where I talking about a field of medicine, this field of regenerative medicine specifically, a field that I'm very passionate about, and one that really has the potential of being a big game changer in this world of orthopedics. Before jumping into that, a little bit about myself. I've been practicing physiatry here in Grass Valley now for almost 18 years now, where I am a managing partner with my partner and friend, Dr. Mike Jensen. We both run Mountain View Rehabilitation together. And I'm double boarded in both physiatry, which is a musculoskeletal specialty, as well as sports medicine. I've been a provider now for Regenexx for almost 6 years now. But to be fair, I've been practicing, or at least studying, regenerative medicine ever since my years in residency. So 18 to 19 years now. A little more about myself is that I've been leading an active lifestyle for the vast majority of my life. Specifically, I enjoy doing a number of outdoor pursuits that allow me to explore and have adventures in our beautiful surroundings of the Sierra Nevada mountains. And I believe this active lifestyle has really shaped much of how I practice medicine. First and foremost, it really drove my passion to pursue medicine, simply because I wanted to learn how the body moves, what it takes to move. And so that really fueled my curiosity. Furthermore, being active, I've had my own fair share of injuries. And so know what it's like to be taken away from these activities that we all enjoy. But I've learned through each and every one of them what it takes and how to heal and recover and get back to the activities that I love. And so it's this active lifestyle that's really shaped our philosophy here at Mountain View Rehabilitation. And that is, at its essence, that we really have a passion, a commitment to get people back to movement and various activities that of their own passion. Why are you here? Well, most of you are dealing with your own injury, and you're dealing with the effects of that injury, which oftentimes include pain, and it's just taking you out of from the things you want to be doing. Other people are here because they've been told that their only option at this point is surgery, and they want to avoid surgery, or perhaps you've been deemed not to be a surgical candidate. Other reasons could be you're just looking for options. You're tired of being on medications, and most of all, you're tired of not doing the things that you enjoy doing. So what we'll talk about tonight, in large part, is regenerative medicine. But prior to that, we'll spend some time just looking at current options, or traditional options, I should say, to care. Then we'll dive into regenerative medicine and this other field of medicine called interventional orthopedics, which really is a key component to what makes regenerative medicine work. And then I'll talk a little bit more about Regenexx, which is a company that I've been affiliated with, and explain a little bit more about what Regenexx is all about, and also explain why Regenexx is so much different than any other clinic offering this type of treatment out there. And then we'll clarify some misconceptions in this world of regenerative medicine. And then we'll finish up by a question and answering session. So current options in orthopedic care. Basically, there's 3 different categories: medications, conservative treatment, and surgical treatment. Most of us start this adventure of, returning or recovering from an injury through taking medications. And this could include over-the-counter medications, but oftentimes people progress to prescription strength medications. And this could be anti-inflammatories, opiates, steroids. But ultimately, we find that medications are a temporary Band-Aid at best, and many of these medications have pretty significant side effects. Typically, the next step in our journey leads us to some sort of conservative treatment. And that could be physical therapy, chiropractic treatment, acupuncture, even bracing. And, as a rehab doc, I really do believe in the conservative mode, specifically physical therapy. And the reason for that, in large part, is anybody who walks in my clinic, we always discuss the goals of treatment. And those goals are first and foremost to get the pain addressed. And once addressed, then the rehab becomes critical. For the rehab is the only way that can address these mechanical deficits that oftentimes cause the injury in the first place. And physical therapy is unique in the sense that they can offer both. I always like to term it as the complete treatment. If, however, one's not able to get their pain addressed adequately, then sometimes we resort to injections, mostly using steroids. Sometimes we'll use a product called hyaluronic acid injection, which is specifically for knee arthritis. And in some cases, the injections can adequately address the pain to allow one to progress appropriately in the rehab program. But frequently, the effects are short-term, and of course, steroids have their own side effects. And then classically, most of us have evolved over time, believing that surgery really is the last and only option. And in this case, we might be referred to go talk with a surgeon, and they may discuss with us the possibility of replacing a part, removing tissue, or even repairing tissue. And again, at one time, many of us believed that surgery was really kind of the panacea, that they could address any injury that wasn't addressed by conservative care. But over the years, we're finding that there's holes, there's problems with this approach. In some cases, it's ineffective. Certainly, there's risk factors. And even if the procedure is effective, it doesn't necessarily work for everybody. And then, of course, once done, it can't be undone. Over the last 5 to 10 years, extensive research has been done on orthopedic surgical outcomes. And again, the research is showing us that there's holes in this process too. Specifically, the research suggests that up to 53% of surgeries are completely ineffective for these orthopedic issues. So again, there's holes in this model. It's not the panacea that we once thought it was. So what are the alternatives? For the rest of the talk, we'll be talking about a very significant alternative, powerful alternative, this world of regenerative medicine. And as I say, the potential of this field really does have the potential of being a game changer in the world of orthopedics. What is regenerative medicine? Well, at its core, it's just essentially using your own cells, namely platelets and stem cells, to heal tissues, or in some cases, repair injured tissues such as tendons and ligaments and meniscal tears, even discs, or addressing nerve decompressions, or in other situations, addressing the symptoms that stem from degenerative changes, including arthritis. What can be treated? Well, in our clinic, we're a sports medicine practice, so we treat all joints: knees, shoulders, hips, spine, elbows, ankles, hands, and thumbs. And all of these tissues have a basic tissue surrounding the joints. Namely, they all have their own tendons and ligaments and other soft tissues, as well as the joint itself. And first and foremost, before even treatment's applied, it's very important to establish a diagnosis. And once a diagnosis is established, treatment outcome goes up significantly. What is interventional orthopedics? Well, in a nutshell, this branch of medicine really is the key to making regenerative medicine work. And what it is applying technology, namely X-ray imaging as well as ultrasound imaging. And what this does is it allows us to place these cells precisely in the injured tissue. The correlate to this field is what's known as interventional cardiology. Now, many of you may recall that at one time, the only procedure option for heart issues was speaking with one of our cardiothoracic surgeons, who, if appropriate, would access the heart by opening up the chest. Well, back in the late 70s, early 80s, some very smart cardiologists learned how to insert a catheter in the vessels in an individual's leg, and with the use of X-ray machines, help guide that catheter all the way up to the heart, where specific treatment can be applied. Namely, they can place a stent or even remove tissue if necessary. Well, the world of interventional orthopedics is very similar in a sense that, again, we're using imaging techniques to help supply or deliver these cells very specifically to the tissue. And the significance of this, the potential that really, as I was mentioning a moment ago, this world has the ability to be a game changer. And the leading minds in these fields really feels that over the next 5 to 10 years, like interventional cardiology, this approach will replace many of the orthopedic surgical alternatives out there, up to 70 to 80% of that surgery. So again, it's using needle-based image-guided delivery of your own cells. Diving in a little bit further, in the world of orthopedics, there's various procedures ranging from simple injections all the way to surgery. The vast majority of folks providing injections do so without any type of image guidance. It's a simple injection that they're placing in the joint in hopes of the medication will somehow get to the area of injury. And many times they're not even making specific or identifying a specific tissue that's causing the injury itself. In the world of technology, more and more clinics are bringing in ultrasound imaging to help with the guidance of these injections, but still many of them are not necessarily making a specific diagnosis, and they're certainly not trying to deliver the medication to any specific tissue. That's in contrast to interventional orthopedics, which first and foremost identifies that, in the case of, say, a hip joint, that there's various tissues that could be injured, that could be causing the symptoms of pain, or it could be a combination of various tissues. So again, identifying specifically what the tissue is that's causing the symptoms, and then following that by, again, placing these cells very specifically in the injured tissue. So that's the case of the hip joint. Likewise, for the knee joint, there's various tissues that need, the problem needs to be identified, and then the cells need to be placed very precisely to the injured tissue. And likewise, the shoulder joint, very much the same way. What do we inject? In the world of orthobiologics, which is another name of regenerative medicine, we have various cells that we inject, including concentrated platelets, platelet lysate, as well as stem cells. Now, platelet-rich plasma is simply platelets that we get from a blood draw. So the first step is drawing blood. Once the blood is drawn, it's sent to the lab where it's processed into a very concentrated platelet solution. And the platelets contain proteins, namely growth factors and cytokines, which are very powerful healing tools. Cytokines can help clean up toxic chemicals or mop up chronic inflammation. And once that's mopped up, that will kickstart the healing process. And then from there, the growth factors can provide that stimulus to get that healing process up and going as powerfully as possible. And we usually use platelets to repair tissues such as tendons and ligaments, as well as meniscus and labral tears. We also use it in the case of mild to up to moderate arthritis. Platelet lysate is taking that platelet cell and essentially lysing the membrane, breaking up that membrane. And what that does is it allows for the immediate release of these proteins, namely the cytokines and growth factors that we were just discussing. And we have found that this particular product is very helpful at addressing nerve injuries, because we found that it is helps address the inflammation much quicker. It's not pro-inflammatory like regular platelets can be, and also offers a growth factor to allow that nerve to heal. So again, we're using this in compressed nerves, whether it be in the case of carpal tunnel syndrome or a pinched nerve in the spine. And then we have stem cells. Stem cells are probably our most powerful tool in our toolbox. And stem cells can directly repair tissue, namely by a stem cell, once it's injected into a specific tissue, whether it be cartilage or tendon or ligament, it can directly differentiate into that tissue. And again, create direct healing. The other approach that it works by is it's kind of like this conductor of an orchestra, if you will. And so what it does is it communicates and signals to all these various players that are involved in the healing process, gets them to the site of injury, and helps them work together in a synergistic fashion to create healing. We get stem cells mainly from bone marrow concentrate. And again, stem cells can help repair tissue, and we're using these mainly for more moderate to severe arthritis, as well as more severe ligament injuries such as ACL injuries and that type. Now, our procedure breakdown, 80% of what we do is PRP, which means 20% of what we do is stem cell. And that's significant, first and foremost, because it tells us that platelets in their own right are very powerful healing tools. But in addition, they're a little bit simpler, if you will, in stem cells. Stem cell procedure is a multi-day procedure. Platelet procedure is just a single-day procedure. And that also leads to a significant cost difference too. So again, 80% of what we do is the platelet procedure. Now, what is Regenxbio? In a nutshell, the folks who started Regenxbio in Colorado really are truly the pioneers of both the regenerative medicine world as well as the interventional biologic orthopedic world. And through this combination, have developed a very powerful and advanced regenerative tool to allow for these healings that we discuss. Now, many of you have, I'm sure, done significant research in stem cells and regenerative medicine. And as I'm sure you've discovered, there's a lot of options out there. But what I wanted to focus on next is just exploring the many ways that Regenxbio is far different than any other option out there. A variety of issues, namely experience, their commitment to research, not only clinical, but lab, as well as researching and developing the lab platform to optimize these cells and what they can do for healing. They pioneered many of the image guidance techniques, and everybody who's involved or is part of the Regenxbio affiliate team is trained in image guidance. There's also the data registry. All of the affiliates are specialists. Our cell source is very specific to stem cell, and I'll touch on all of these different categories. So harvesting and dosing are other ways that we are different. So as I mentioned earlier, Regenxbio has been doing this longer than anybody, and again, has developed many of the interventions that are being offered these days. Now, to be fair, our vet colleagues have been doing regenerative medicine for a longer period of time. They started working on horses as way back as early as the 80s and early 90s. But again, when it comes to human treatment, Regenexx really is the leader and the pioneer. And ultimately, experience makes a difference. Experience will optimize. The more experience, obviously, the more optimal the outcome is going to be. Our lab platform is far different than any other clinic out there offering this treatment. Most folks who are offering this treatment have a bedside centrifuge. And what that means is once the blood or the bone marrow has been harvested, it's placed in the centrifuge, a button's pressed, and out comes the other end. Out the other end comes the same product for everybody. So there really is no customization. The other factor with this is that these folks are not able to concentrate the cells to the concentration that we can with our platform. So yes, we have a centrifuge as well, but we also have a full-on lab hood with all the various tools such that we go through multiple cycles of centrifuging, but in between each and every cycle, the cells are manipulated further to help increase concentration and purity. And again, ultimately, we increase that concentration, and that's going to affect outcome significantly. Our cell source specific to stem cell is very specific to bone marrow. Bone marrow is the only cell source that has been a compliant cell source with the FDA, and that's important. But also, it has been by far the most studied cell source and really has been proven to be the most powerful cell source. Anything else is potentially illegal or not a cell source at all. So again, this research really does bring peace of mind and confidence, and again, optimizes outcome. We've developed techniques here at Regenexx regarding harvesting, namely, when we're accessing the bone marrow, we have found different ways, different techniques that can help increase the number of cells that we actually get from the aspiration. And again, when it comes to stem cells, the more we increase that number of cells, the better the outcome we're going to have. So again, we optimize techniques to maximize the number of cells. And again, this has led to much better outcomes. Dosing is also important. As I say, because of our unique lab platform, we are able to customize each and every individual and give them a custom treatment specific to your issue. And we have tools that, especially after the bone marrow processing has completed, that allow us to measure the number of stem cells. So we know specifically what's going into each treatment option or each treatment specifically. And again, that's something that you're only going to get at Regenexx. And this too is critical of outcome. Now, I touched on the importance of image guidance. Again, without these tools, we cannot place the cells in the injured tissue. And without that, we're just not going to have a good outcome. With it, we found that it's critical to optimizing outcome. Now, jumping into the research avenue, this is probably the main reason I became an affiliate of Regenexx is Regenexx's devotion to research. And that starts with the data registry. Anybody who gets treated with a Regenexx procedure is invited to join this registry. And what this registry does is follows the patient for initially every few months after the treatment procedure, and ultimately once a year for a few years after the first year and a half or so. And so this has led to a database that is second to none throughout the globe. We have the most data information on these cells in the world. And this has led to many of our research, both clinical and laboratory. And the importance of research cannot be understated. I came across a quote recently that namely states that without data, you're just another person with an opinion. So, if this world of regenerative medicine is going to evolve and get better and be around for the long term, the research is critical. So that data registry feeds our clinical research. There have been a number of papers published in various peer-reviewed journals, and Regenexx really has the vast majority of these journal publications out there. Again, the more data we can get, the better treatment we're going to be able to offer, and that does lead to, again, improved outcome. The lab search is critical as well. There are a number of PhD scientists that work in the Regenexx lab in Colorado that are constantly tinkering with ways to make these treatments better. And they have evolved over the course of years. What we're offering now is better than what we offered 5 years ago, and that will continue to be the case in another 5 years. Furthermore, anybody who's an affiliate of Regenexx, we are a specialist. We specialize, and we all have a passion for musculoskeletal care. Many of these treatments that are being offered out there are being offered by nurse practitioners, physician's assistants, and not only are these not physicians, but they're not specialists, and so their level of knowledge regarding this field is a fraction of what Regenexx specialists have. And again, that will make a difference in outcome. Knowledge is power. So what's a procedure flow look like? I touched upon this a little bit earlier. In the case of a platelet procedure, it starts with an initial evaluation, and that usually lasts an hour. And the evaluation, first and foremost, we get a diagnosis. And once we have a diagnosis, we offer a treatment plan. And with that, we give a very specific prognosis in terms of what you can expect from the procedure and the outcome that you can expect from it. If you're deemed to be a candidate and proceed with the procedure, then the next step is getting scheduled for the blood draw. Once the blood's drawn, it goes to our lab here in the clinic. It takes about an hour or so to process. You come back a couple of hours after the draw where the injection is done. Oftentimes there's rehab or physical therapy afterwards, again, to touch upon the rehab mode to correct these mechanical deficits that are oftentimes the cause of the injury in the first place. And I always like to explain to folks that despite how powerful these cells are in terms of providing healing, the rehab is important, critical really, again, to correct these mechanical deficits. With the stem cell, again, we have a 1-hour exam to verify candidacy. And then if the treatment is recommended, then the stem cell involves a 3-day procedure. Day 1 involves injecting an irritant into the tissue. And what this does is prepare the tissue for the stem cell. In other words, tills the soil, so to speak. 2 days later is the stem cell procedure, and that starts with the aspiration, which is typically done first thing in the morning. Once completed, it goes to the lab, and for bone marrow, it takes a few hours to process. So again, usually aspiration is done in the morning, come back in the early part of the afternoon for the re-injection. And with that, not only are we injecting stem cells, but we're also able to get platelets from bone marrow, and that's re-injected as well. And then day 3, which is typically 2 days later, we do a PRP injection. And again, that starts with a blood draw in this case, which is re-injected a couple hours later. And again, frequently followed up by physical therapy. And then for both procedures, we offer a follow-up visit, at least one visit a couple months after the procedure. Now, again, in this world of regenerative medicine, because it is so new, there's a lot of hype out there. And we're finding that one of the biggest culprits of this hype is this world of amniotic or placental or cord, quote unquote, stem cell injections. Now, the quotes are in place simply because there has been a lot of studies evaluating this product in amniotic fluid, both in Regenxbio lab as well as a number of, a good dozen reputable universities around the country. And all the tests have shown that there is no live stem cells. In order to process this material to make it injectable into another person, it has to be boiled essentially and then frozen. And this process, again, kills off all the cells. And the extent of this misrepresentation can't be underestimated or can't be understated. I mean, the FDA has classified this as a dead tissue product. And until recently, the FDA, this has been the law for a number of years now, but until recently, they really haven't regulated it. But in fact, starting tomorrow, they will be regulating it to the nth degree. So starting tomorrow, there's a good possibility that many of these clinics will be shut down. And there could even be jail time in line for many of these clinics who've been abusing these regulations. And, the number of these clinics, I can't explain to you how many of them there are out there. I see patients at least a couple of times a week these days who bought into and gone through the process really to have no improvement whatsoever. Now, to be fair, there are growth factors in these products that can help with the healing prospect or the healing potential. But we have found that the growth factors is a fraction of the number of growth factors that are in a simple platelet procedure. Yet they're significantly more expensive than platelets, and they certainly can't hold a candle to the stem cell, which is even more powerful than platelets. Many of these procedures are offered in chiropractic offices where they're performed without guidance by somebody who's not a specialist, namely a PA or a nurse. And again, these are dead cell products that can be very pricey, much more expensive than platelet injections in many cases. They have a big marketing scheme, and a lot of their marketing involves telling folks that their stem cells they're not good because you're just too old. And because of that, you have to use young people's stem cells. Well, we have done extensive research in this realm and have found this just simply not to be true. We have found that people in their 80s and 90s respond equally as well as people in their 20s, 30s, and 40s. There really is no bearing on age, it would appear. And I treated people as old as 97 years old, and they've done quite well. So again, as you're doing your research, it's imperative that you do your due diligence and look out for these red flags. If they're offering heavy discounting or heavy emphasis on financing, well, that might be a red flag. If they're offering the magic cure-all that can treat anything from cancer to hangnails to arthritis, that's probably a red flag. If everybody's a candidate, obviously they're not doing their due diligence to really vet who might do best for these procedures. If everybody's a candidate, again, that's a significant red flag. Anything calling amniotic, calling it a stem cell or cord blood, again, all red flags. And there's been a lot of research on stem cells taken from fat. And there does appear to be a lot of potential in stem cells from fat. But right now, in order to access those stem cells, it's considered more than minimal manipulation. And because of that, is actually illegal to do in this country. So who can you trust? Again, as you do your research, I've come across this website who is a very unbiased source. And they have vetted all the various clinics in this country, or at least a good portion of them, and have given them certain grades on, research they've done, whether or not they do guidance, et cetera, et cetera. And I find that it's a very fair and unbiased way to review specific clinics. So write that name down, stemcellreview.com, and I invite you to check them out as you're doing your research. So in summary, we have discovered through this combination of interventional orthopedics and regenerative medicine that we have a very powerful alternative to surgery. That movement, we can get people back to moving without surgery. Regenexx is a leading provider and researcher in this field, and really one of the leaders in the nation, if not the world. And again, be cautious of the magic stem cell approach. Do your research, and make sure you know what you're getting into. Now that's the bulk of our material today. But before jumping into the question and answering, I just want to invite you to, if you have any other questions, or if you want to find out if you are a candidate for this procedure, give our educational center a call, and we can get you set up for either to address those questions or even to come in and get an appointment for an evaluation. And of course, there's more information on our website, naviarehab.com. So we'll keep that on board in case any of you want to copy that down. What we'll do next, we'll jump into our question and answering phase of our presentation. So if you have questions, go ahead and just raise your hand on the monitor there. Okay, so I see a question from Bill. Bill, can you hear me?
Yeah, I can hear you. Can you hear me?
I can hear you, yes. How are you?
Okay, great, thanks. I put a question in the chat, but she said to ask you, can you point me to some of the peer-reviewed literature, or is that on your website? How do I see that?
Yeah, we have some on our website. If you go to our blog on our Facebook page, I've been posting a lot of research that it's done by other sources that is accessible. Yeah.
And then I also asked, I guess, Dana, the question about getting the bone marrow out. That seems complicated to me, but it sounds like not as risky as I feared.
Yeah. Well, I mean, first and foremost, it's important to understand that we numb you up like crazy. And interestingly enough, into the marrow itself, the cavity where the marrow lies, most people, pretty benign, don't notice much of anything. But when we actually start pulling the marrow out, there's something about that negative pressure, a little irritating. But it's a fairly quick pull. So if it is uncomfortable, it just lasts for a few seconds.
Is it similar to what has to be done with people that get like leukemia or being treated for leukemia and they take bone marrow?
I've come across a lot of folks who've had to get biopsies from that. And oddly enough, when they're doing biopsies, they don't seem to numb people up quite as much. So I've run into a number of people who've, had some uncomfortable experiences from that. And a lot of folks come in with theories of their own, but again, are pretty surprised about how benign it is to actually get the marrow.
Okay, thank you. And then I don't know if this is appropriate to ask, but can you give me a ballpark sense of the cost I have an ankle problem. I had an MRI. It's frayed tendon, I guess they call it. Like is it? Yeah.
Well, so if it's a platelet procedure, ballpark is 12 to 1300 for stem cells because it's a little bit more involved, a little more pricey, and we're charging 6,300 for all three procedures there.
I see. And I hate to I hope there are other people that have questions. I just have one other one. The PT Is that done at your clinic, or do we do that at home and you just tell us what to do?
Well, so typically what we do is we'll refer you to a therapy in your location.
I see.
And if we can recommend somebody, we'll do so. If not, we just ask you to do some research, and we'd set up a referral to the physical therapist.
Okay, thank you.
You're welcome. Thanks for coming.
Yeah.
Okay. Got a question from Tom. Can you hear me?
Okay, can you hear me?
Yes,
Yeah.
there you are. Hi.
Yeah, thank you. My internet dropped me for a few moments there. Maybe this question's been answered, but what I'm wondering is how often, how many treatments I'm going to have to get. Is this a one-time deal, or am I going to have to come back every month, every year? I've got an arthritis in my ankle. It's been an ongoing condition for 20 or 30 years. It's gotten to the point where they say the cartilage is pretty much worn away there.
Okay. Well, so the vast majority of folks, it's a one-time procedure. If it's in the case of stem cell, if it's a arthritic joint, that procedure may last 7, 8, 9 years. So it may not last really, but a fairly long time. In the case of, say, tissue tears like ligaments or tendons, sometimes it's a cure. I mean, it will address that injury as long as it's not re-injured. I mean, to be fair, that there are some folks, like in the case of platelets, for example, that might need to come back for a second procedure, probably a third. But I would say 85 to 90% of the folks are just the one procedure is all they need. And if a second procedure is being considered, we usually wait till the 4-month mark before making that decision.
Okay. And then follow-up question. I was, the insurance issue. I know insurance doesn't cover your treatment, but does it cover like the informational meeting? Do you know?
Yeah. So we take most insurances. And so, yes, the insurance will cover the evaluation. Oftentimes, if there's additional imaging that needs to be done, they'll cover that. And in some cases, we require bracing, like for the knee, sometimes the ankle, in which case the insurance usually covers that as well. The only thing they won't cover is anything related to the cell injection themselves.
Okay. All right. Thank you.
You're welcome. Thanks for the question. Okay. Got a question from Sharon. Can you hear me? Sharon, can you hear me?
Yes, I can, Dr. Richneck. Hello.
Hi. How are you?
I'm good, thank you. Well,
Good.
sort of. My questions are, I think what I am a candidate for is the PRP. What I'm wondering is, I have knee problems, and I think it's the tendons around the knees. They've both been replaced. Rotator cuffs, both rotator cuffs, and my back. So would I come in 3 times, or can you shoot me up all 3 times at the same time, or, same visit?
Yeah. Well, so if it's anything but the back,
Yeah.
we'll combine treatment. We'll combine shoulder and a knee treatment. If it involves the back, that's a separate procedure altogether, simply because my colleague, Dr. Blaze, does all the spine procedures.
Okay.
Spine gets pretty involved, whereas I do all the other joints. And so two different practitioners, so usually not typically done in the same day.
Okay. Yes, I've gotten an injection, I think it was in January, from Dr. Glaze, and didn't really relieve any pain. It's real hard to because my shoulders are in a lot of pain from me lifting myself up to get up because of my knees are in a lot of pain. So it'll probably be two different things. So I think the best thing for me to do is to get your 1 hour evaluation, huh? That sound good?
Yeah, and if it looks like did you just get an injection from Dr. Glaze earlier this month?
No, January.
Oh, okay.
I think it was January.
Okay. Okay. Well, yeah, I mean, we can just get you in, as a follow-up and just kind of review that. I'm looking at my
Okay.
quick, and it sounds like there's some temporary relief from that. So at the very least, we got some information from that.
Yes.
That can help, specify more specific treatment options.
Okay. Because what I think I'm dealing with is pain around the knees. I think it's the tendons, because everybody tells me that the knee replacements are where they should be, and that needs to
Right.
be definitely somebody tell me if that's true.
Yeah, so not unusual to get other soft tissue issues after knee replacement. Large
Yeah.
replacement itself, it's never gonna restore the mechanics that were there naturally.
Right.
Because of that, a lot of times what tends to happen is you're stressing the soft tissue around the knee, which can lead to other pain issues. So
Yeah.
not get additional pain after surgery.
Yeah. I gotta figure out something. So I definitely will be giving you a call, and thank you so much for doing this presentation.
You're so welcome. Well, thanks for the question. We'll see you soon.
All right, you will.
All right. Take care.
Bye. You too.
Bye. Okay. Next question is from Wanda. Can you hear me?
Hi. Yeah.
Hi.
Am I unmuted now?
You are unmuted.
Okay. All right. How do you distinguish between if one needs a platelet injection or stem cell?
Well, so it depends on the specific issue. So for example, if it's more severe arthritis, then we'll probably recommend the stem cell. Or if it's a severe tear affecting like the ACL, or if it's a rotator cuff tear that's almost completely torn, we might consider a stem cell for that. But the vast majority of other issues, simple tear to the meniscus, tendons, ligaments, again, 80% of the time we're doing platelets in that case. And even in the case of more mild to moderate arthritis, a lot of times we can get by with platelets as well. So it just depends on the specific situation.
Okay. I guess, let's see. So you mentioned arthritis and nerves and tendons. What about doing if you have muscle, the actual muscle is strained? Like, what I came to see you for recently, the piriformis strain.
Right,
right. Is that a diagnosis that's appropriate for platelet treatment?
In some cases, yes. I mean, the vast majority of times we'll address that through, simpler like trigger point injections and
right. Oh, okay.
Working on the proper hip stabilization, for example. I find that a lot of times hips, especially related to backs, can become unstable. And what that does is it just places a whole different stress pattern on the soft tissue, such as the piriformis, that's not designed to take that stress. So more times than not, the rehab, the stabilization process will address that.
Okay, so that is it. What is the most common diagnosis that you have successfully treated with platelets?
Probably knees, followed by shoulders and spine.
Would you say knees and what? Spine?
knees first and then followed by either shoulders or spine.
Okay. Okay. All right. Thank you.
Okay, Wanda, thanks for the question. Take care. Okay. Have another question from, let's see, Don, can you hear me? Or Dan?
Dan,
Sorry. Hi, Dan. How are you?
I'm doing good. I just have a little bit of a crisis situation. I really appreciate the PRP injection on my shoulder you did about 2 or 3 years ago. No problem at all. It's
Great.
wonderful.
Fantastic.
Now I have a little more of a situation because the reason I went to a cardiologist not too long ago is to get clearance for a spinal stenosis, minimally invasive decompression.
Okay.
I'm taking Plavix because of the stent that they had to put in my heart. And I'm wondering if perhaps I can avoid having to suffer until August taking Plavix and not getting spinal stenosis surgery and possibly getting a PRP injection into the facet joints that are arthritic and in the spinal stenosis situation.
Yeah.
Is there any hope for me?
Absolutely. I mean, I'm looking at your MRI report real quickly here, and there is some narrowing to the spine, but I'm not seeing anything that looks severe. In which case, it's very possible that there is something else contributing to your pain. So, the first step is just taking a look and see if we can identify specifically what is causing your pain, and then just take it from there.
So there is some hope then. Maybe I should make an evaluation appointment for the spine. My shoulder is not anywhere near as big an issue. My other shoulder that I came and saw you for about 3 weeks ago, and I'm waiting to go to physical therapy for that. But I really think that my spine, I didn't even think about the spine until I realized that I was in a kind of a dead end because of the Plavix, no surgery possible. So, and no hope, now maybe there is hope.
Yeah. I mean, come on in. And as I say, I mean, it's a matter of just trying to figure out what it is that's causing the pain in the first place. And then, from there, we can certainly make more specific treatment recommendations. Okay,
perfect. I'll make an appointment. Thank you very much. Thanks for your service.
My pleasure. We'll talk to you soon. Bye. Okay. Next question is from Alan. Can you hear me?
Yes, can you hear me?
Yes. Hi, how are you?
Hey, good, doctor. Thank you. You mentioned backs a little bit, but I wanted to address that more. In my case, I have severe arthritis and compressed discs in my lower back. And it's very, very severe pain. I've tried prednisone oral steroid. That didn't make any difference. I tried an epidural. That did not give me any relief. So I was wondering if the procedures that you guys do would possibly be able to give me some relief.
I would say that there's a very good possibility of that. Again, as I was just talking to Dan, I mean, first and foremost, it's just a matter of identifying what it is that's specifically causing your pain. And then from that, we can, make other treatment recommendations. So, yeah, I mean, we just need to take a look and try and figure out what that pain generator is and go from there.
Thank you.
You're welcome. Thanks for the question. Okay, next question is from William. Can you hear me? William, can you hear me?
Yes. Can you hear me?
Yes. Hi, how are you?
Oh, I'm just fine. Listen, I had a fall on a ladder and I hyperextended my knee when it got hung in the ladder rungs on the way down.
Oh, boy, ouch.
Yeah, well, I busted both my shoulders too. But I've had shoulder surgeries. But my knee, this happened 2 years ago. They told me that I had a complex tear of the meniscus and a tear on one of the ligaments.
Uh-huh.
I did all my things through the VA in Birmingham because I'm from Birmingham, Alabama, but I'm currently in Sacramento.
Okay.
I actually got the VA to approve the initial examination by you guys over a year ago. And then when I tried to get my records, COVID had hit and I couldn't, and the records offices were all shut down.
Yeah.
So I had hoped I would have to go through the whole procedure again. But well, I know that they probably won't pay for the procedure itself. But
Correct. There's
after
not
2 years now, 2.5 years, would I have to have another MRI and all of that? When I stand up, my knee just pops sometimes and really hurts.
Okay. Well, so you're saying the MRI that you have is over 2 years old.
It's what?
Did I hear you say that the MRI that you have of your knee is over 2 years old?
It's probably getting close to that now.
Okay. So we wouldn't necessarily have to get a new MRI. I mean, it would be helpful to look at the older MRI first, and from there we can further assess it with the ultrasound, and that in combination with a good examination. From there, we can determine whether or not further imaging is going to be necessary.
Okay, well, thank you very much. I'll definitely call your office and set up an appointment of some sort.
Beautiful. And just to let you know, I mean, we've been getting just fantastic success with meniscal tears and even ligament tears with just platelets. So, good.
Well, it's the ligament too that bothers me because it's the one on the inner side of your knee that wraps around and comes around that side.
Yeah.
Is that a tendon or ligament? I don't know, but
it's ligament, and that one in particular is oftentimes injured in association with the meniscus. So
yeah, it wasn't torn off or in two; it was just torn.
Yeah. Okay.
But I will definitely call your office then and make an appointment.
Sounds good. Look forward to meeting you.
Okay. Well, I look forward to talking to you sometime again. Thank you so much for your brief information.
My pleasure. Thank you for the question. Take care.
Yes.
Okay. Next question is from Suzanne. Can you hear me?
Can you hear me now?
Oh, there you are. Hi, how are you?
Good, how are you?
Good, thanks.
Well, I wanted to let you know that I'm a good friend of Mark DiMartini, and I know he's one of your absolute success stories, according to him.
Yeah. No, Mark he's wonderful. He's done really well, which is
oh my gosh, mountain biker extraordinaire, right?
Exactly.
He got his hips in shape. So
yeah, no.
My question is, I broke my hip in 2013, and in 2016, my orthopedic doctor back home had determined that I had osteonecrosis going on in that area of trauma. Can you hear me? Hello?
Yeah, can you hear me?
Oh yeah. I thought I lost you for a minute. And he said it was, I didn't have to do anything right away, that it was slow growing, but it has been really bothering me with hiking and skiing. So I went to my doctor here and they did just an x-ray and they're not willing to do anything else because they said it's just arthritis.
Uh-huh.
So wanted to get your opinion on that. Should I go ahead and just push for an MRI, or would the osteonecrosis be causing arthritis? I'm not sure how those work together.
Well, so you've been told that you have both osteoarthritis and osteonecrosis?
Yes.
Okay. I mean, a lot of times you can't really tell if there's osteonecrosis without an MRI.
Yes, and they weren't willing to go forward and do the MRI here yet.
Okay. And when they reviewed the X-rays with you, did they find some flattening of the ball portion of your hip joint?
They didn't really review them with me. I just got the diagnosis over the phone. But what I can tell you is that when I fractured my hip and my femur in that accident, kind of the ball of the femur was crushed in. So they had to kind of, in surgery, had to push that back out. I don't know if that.
Okay. So, I mean, unless there's some changes on the surface of that ball that look like flattening, there's no way they can tell you that there's osteonecrosis without an MRI.
Okay.
So, I would say that the first thing is, we may not have an accurate diagnosis.
Okay.
It can certainly show it if there's arthritis.
Right.
But again, unless there's that flattening, you can't really tell if there's necrosis or not. So,
okay.
I mean, again, it all just kind of starts with just verifying that diagnosis.
Okay. So go ahead and push to get the MRI, I would imagine, right?
Yeah, I mean, who's the provider? Is it an orthopedic surgeon or?
No, I'm just going through my regular, I had trouble getting insurance here, but I'm with Blue Cross Anthem now. So it was just with a physician's assistant who's kind of my point person.
Gotcha. Okay. Yeah. And a lot of times, just taking a look at you can give us that answer too.
Oh, really? Huh.
So, I mean, that might be another option is, come on in, we can take a look, review your x-rays, examine you, and, give you some further clarification from there as to whether or not more imaging is necessary.
Oh, okay. Because I thought, I forget the name of the woman that I had talked to probably 6 months ago who said I really needed to get another MRI done.
Not necessarily. I mean, again, if you're having difficulty getting that done, and there's questions on the diagnosis, then sometimes it's best just to take a look at you first.
Oh, okay, all right. But get the X-rays, right?
Yeah, were those done here locally?
Yeah, Insight Imaging. I don't know.
Okay, yeah. I mean, just ask them for a CD, and they'll copy that for you and bring it on in.
Okay, all right. Sounds great.
Oh, okay. Well, thanks for joining us tonight in the question.
Thank you for hosting this. This is
okay. You're welcome. Take care.
You too.
Bye-bye. Next question is from Lisa. Can you hear me?
Hi. Yes, thank you. Good evening.
Hi.
So,
how are you?
Hi there. Fine, thanks. So my question is two-part. In reviewing some of the literature yesterday, we noted that there are some medications that were recommended to be held, if possible, for about 6 weeks around the time of the injection. Specifically some blood pressure medications and blood thinners. So my question is, number one, if because of coexisting medical conditions like heart disease or diabetes, those medications cannot be held, does that affect how effective the injections will be? And then number two, is there any effect of doing either the platelets or the stem cells in someone with those other coexisting conditions?
And I'm sorry, name the conditions again?
So heart disease?
Uh-huh. Okay. Well, so in regards to like blood pressure medications, for example,
Yes. Mhm.
so, I mean, there are certain blood pressure medications that seem to impair the healing process, where there's others that do not. So if you're on one of those medications that seem to impair, then the next step is just, talking to your doctor to see if you might be a candidate to be transferred on to another medication that doesn't impair the healing for a 2-month period of time. So, I mean, sometimes we can circumnavigate those issues just by, either placing on a different medication. In the case of statin medications, a lot of times it's okay just to stop and take a break for a couple months. A lot of people do that routinely. And then in case of like blood thinning medications, depending on what the medication is, if it's a short-term blood thinner, then the suggestion is, I mean, the only time we would take somebody off that is if they're going through the stem cell procedure. And the indication is just going off of it for just 48 hours before the actual aspiration, and then restarting it right after the aspiration. So, oftentimes we're able to get around some of these issues.
Okay. And is that something that would be discussed during the individual, the initial consultation? Mm-hmm.
Exactly. Yes.
Okay.
Absolutely.
Okay. Well, thank you.
Okay. Well, thank you for the question. Bye-bye. Okay. I think I saw another question from Roger. Can you hear me? Try that again. Can you hear me, Roger?
Let me do this.
Hi there.
Okay. Yeah. What about the heart medication for Plavix, which is supposed to stay on for a year after a stint? Still have, right? If we're talking about a arthritic knee here, we're wondering actually what is minor, which maybe the PRP would work on, as opposed to what I have is they tell me X-ray is bone on bone, and they say the next step is a new knee, and I'm on Plavix now until September of this year. So I'm just wondering whether it's possible, maybe if the platelet injection may help, and if you need to stay off of Plavix for that.
Yeah. Well, so not as important with the platelets. And in the case of more advanced arthritis, platelets can be effective, but they may not last as long as, say, a stem cell procedure. For example, people with severe arthritis who get platelets, they may get good relief that lasts about a year. But what we've started to do more recently is, in some of those cases, we'll combine it with like a hyaluronic acid injection. And there seems to be some good research showing that the combination of the two may even work better than the platelets alone, and certainly better than the hyaluronic acid alone.
Okay, so again, we should talk about it.
Yeah.
Your cortisone treatments don't work anymore.
Yeah, because I actually had the hydrotic 2, and I've had many cortisone shots. They just don't work anymore. Yeah.
Okay.
So, anyway, that's enough.
Yeah, I mean, come on in. We can take a closer look and talk more specifics at that time.
Okay, thank you.
Okay, you're welcome. Thanks for the call. Okay, next question is from Alfred. Okay, can you hear me, Alfred? Let me try it one more time. Try it one more time. Can you hear me, Alfred? Well, I'm clicking on your unmute button here, Alfred, but I doesn't, no, maybe now. Can you hear me? Alfred, can you hear me? Might have be having some technical difficulties with that. I'm going to move forward and come back to you later in a moment if I can, Alfred. One moment, please. Let's try Ginger. Can you hear me? Question from Ginger. Can you hear me?
There we go. Can you hear me now?
Oh, beautiful. There you are. Yes. Hi.
Oh, wow. I didn't know that picture was going to be there. Okay. So I'm just curious, and thank you for providing so much good information tonight. This is really, really good.
Fantastic.
As to how long one might expect to actually see and feel results after either a PRP or a stem cell injection, and if are there differences in the timelines for results, so what should one expect when proceeding?
Yeah, good question. I find that most people within the first couple of months are noticing a fairly significant improvement. And for up to at least 4 to 6 months, at 2 months, I find most people are probably in that 40 to 50% better category. And at 4 months, the vast majority of their symptoms have been addressed. But it's important to understand that the healing process really, in the case of platelets, will go on for all the way out to 8 to 9 months. And in the case of stem cells, goes out all the way out to 12 to 18 months. So it is a process, but again, most of the time people are feeling pretty significantly better within 2 to 4 to 5 months anyways.
Oh, terrific. So that process, and that makes sense that it's a healing process. So this, these cells take time to heal. So that makes a lot of sense.
Yeah, exactly.
Thank you.
You're welcome. Thanks for the question. Let me try Alfred one more time here. Can you hear me, Alfred? Sorry, Alfred. I can't seem to get through. Another one from Randy. And Alfred, maybe I'll just suggest maybe if you can text in a question and Dana can read it off to me at the end and we can try and address it that way. So maybe try that. And I'm sorry, is it Randy? Can you hear me?
Yes, I can hear you. Can you hear me okay?
I can hear you fine, thanks.
Okay, good. Just a question. My wife has had hip surgery and they had nerve damage from the hip replacement. Does your procedure take care of nerve pain? Specifically the
neuropathy in the foot.
Neuropathy that runs all the way down her leg into her foot.
Oh, the sciatic nerve.
Sciatic nerve.
Okay. And it's been established that that's related to the hip surgery?
Yes.
Yes.
Okay. Are you having like weakness in the leg too?
Not necessarily weakness. It's just kind of tingly. It's kind of what people would call neuropathy. And it goes the big toe and the next toe and then through the bottom of my foot, but not to the heel.
Okay. Well, I mean, there is a chance that could be coming from the back. It's the reason for my hesitation. It may not be the hip at all.
Oh. Well, the surgeon did say that he did pull the nerve, sciatic nerve, but he did not cut it, is what he said.
Oh, I see. I see. Do you know if it was an anterior versus a posterior approach?
was posterior.
Posterior.
Posterior. Okay. Okay. Well, I mean, we do use this for nerve injuries, yes, and we're getting some successes with them. This is kind of a rare event. I can't say that I have direct experience treating the sciatic nerve after hip surgery, but it's something that, you know, as I say, if we can pinpoint a specific compression point, then it's certainly something that could be feasible.
So it may be worth pursuing then.
Yeah, exactly.
Okay, very good. That answers the question. Thank you very much, sir.
Thank you.
Okay, you're so welcome. Thanks for the call. Okay. Now, as I'm scanning down here, I don't see any other hands. So if there are no further questions, that's the essence of the presentation. I want to thank you all for coming out tonight. And again, if you have any
Dr. Richnack?
Yes.
I do have the question here from Alfred.
Oh, perfect. Thank you. What is that?
Okay. He says, I'm an 82-year-old and a tennis player until about 4 years ago due to knee pain. In 2013 was told my knees are bone on bone and arthritis was bad. Total knee replacement for both knees was recommended. I'm a diabetic and did not have the surgery. I can still walk a mile, but can hardly stand more than 40 minutes. Interested in coming to see you. Do you need MRI of the knee? If so, where can I get it?
Well, so oftentimes you can get an MRI from your family practitioner. You know, being Medicare, typically there's no problem getting an MRI. If they're not comfortable ordering that for you, then, you know, we'd be happy to evaluate you. And in that case, you know, sometimes just getting, bringing your x-ray so that we can at least assess the status. And at that point, if necessary, I mean, I can certainly order the MRI as well. And again, usually we don't have a problem getting that approved with Medicare. So I hope that addresses your question. And again, I mean, if your diabetes is well controlled, and you're taking good care of your sugar and have good, you know, good diet and are staying active, or at least as active as you possibly can, you know, you can still have a good result with the stem cell. So I hope that addresses your question. But again, you know, certainly there's probably other questions out there. Don't hesitate to give us a call. Our educational staff does a wonderful job at addressing questions, and certainly can help you set up an evaluation if you want to see if you'd be a candidate for this procedure. So I want to thank everybody for coming and joining us tonight, and look forward to seeing you in the clinic.